Hey guys, let's prevent your baby's brain from bleeding, please. So, why are babies at risk for intracranial hemorrhages or brain bleeds? So, there are a couple things. Before you're born, there are two holes in a baby's heart that help them to bypass their lungs. After you're born, those two spots are going to slam shut during the first few hours or days of life, which allows then blood to flow to your lungs and pick up some oxygen. When that happens, there's a couple things that happen with blood pressure, right? So your blood pressure in your lungs is going to go down in order to allow that blood flow to come in. And the blood pressure in the rest of your body, particularly your brain, is going to go up. Now, when those things change, if you're looking at heart anatomy, the first vessel that comes off your aorta is your carotid artery that goes straight to your brain. Now, babies' brains are special. They have really tiny little blood vessels. They're not very well supported with extra tissue yet, which increases their risk of bleeding. Now, let's say you didn't have the most perfect delivery in the world. Maybe you needed a forceps delivery or a vacuum extraction. Maybe mom had high blood pressure or has got a fever. We're looking for infection. Maybe baby's a little early, less than 35 weeks. All those things increase your risk of bleeding into your brain. That's where vitamin K comes in. So vitamin K is a cofactor for all your clotting factors. And if your liver is not mature enough to produce those yet, you run the risk of hemorrhaging all the way up to the first month. Oh, and by the way, we're going to cut that umbilical cord that's got 3 huge blood vessels, which also hemorrhage is a possibility, right? Babies that don't get vitamin K at birth are 50% more likely to have a brain bleed. Vitamin K, I get this question all the time. Vitamin K given by mouth does not work nearly as well as a single injection of vitamin K given at birth. In fact, the oral stuff takes several days to work, and even when it does, it's still not going to be nearly as good. Now, I don't know how many cases of intracranial hemorrhages in infants you've seen. I've seen a load, a lot. They can be devastating. They cause severe intellectual disabilities, cerebral palsy, potentially seizures, you name it. So please get your baby vitamin K, please. I'm Dr. Deb. Give me some comments below so I know what to talk about next.